Hey folks, if you have any questions for me, slide into my DMs here at Primary Care Pod. We'd be happy to hear from you and happy to address any of your concerns.
This episode of Primary Care is sponsored by Regrowth Health. More than just an ED treatment.
So one of the questions we got in our DMs was, how do you address someone who may be gender fluid or gender neutral when you're concerned you may use the wrong pronoun, or maybe if you already have used the wrong pronoun, how do you approach that topic? Personally, I don't think I'm the best person to answer, as I'm not gender fluid or gender neutral. I identify as a male, and so probably would be best to ask someone who you're comfortable with or who you know that is gender fluid. Also, I think the majority of people are patient with one another, and so if you do accidentally say the wrong pronoun, apologize, certainly try to understand their point of view and then do better next time. I think we're all just trying to learn how to be respectful of one another, and as long as you're coming from a place of respect, I think the other person is going to appreciate that. So let's see. Another one is, hey, Dr. Hendricks, how would I go about learning to grow my thinning and receding hair back? And adamantly, I have ED issues as well. So this is a double question. So if you're concerned about male pattern hair loss, there is a FDA-approved medication called finasteride that can help to prevent further hair loss and initiate some hair regrowth. We're also seeing a lot of patients that have male pattern hair loss do experience hormonal imbalances. So talking to your doctor about whether or not you have low testosterone. There is some clinical evidence showing that the use of testosterone and finasteride for patients with low T does provide the best benefit in helping you regrow lost hair as well as preventing additional hair loss. Something to consider though, if you do have ED symptoms, finasteride has been shown to cause a worsening of erectile dysfunction symptoms in about 4% of patients. We think this may also worsen additionally because those patients have low testosterone. So talk to your doctor about your symptoms. That's number one. They'll determine what's best for you and determine if medication would be appropriate to treat your male pattern hair loss. Okay, this is a very long one. Okay, I'm not sure how to formulate this information, but I have been realizing I may have low testosterone levels or brain fog. Not really sure. A few months back, I started having issues. I would be in the moment with my partner and everything going great. We would have foreplay and I would lose my erection. It has happened more than once. I'm not sure what may be the cause, but I have been watching your videos on TikTok and trying to figure out what's the root cause of this. I'm soon to be 35 and scared of talking about it because of how people may look or judge. Okay, so I think this is pretty common. We get patients that are not comfortable talking about symptoms of erectile dysfunction or sexual concerns with their primary doctors, and that's very common. There's definitely different relationships have with their providers. Number one, I think it's great that you've reached out somewhere that you do feel comfortable, so thank you for messaging us. But I think a great place to get started because of your age would be to consider having your labs checked, determine if there's any sort of biological change that could be contributing to erectile dysfunction symptoms. Certainly checking your testosterone, whether you order a kit online or you talk to your doctor to have a screening lab done, would be a great place to get started. If your testosterone comes back normal, you may have a psychology-based cause for your erectile dysfunction symptoms. Maybe you're anxious or maybe you're feeling a lot of pressure in the moment, and that's very common and very normal. This typically improves after you get to know the person that you're with better, or maybe if you have that dialogue with the person that you're intimate with, explaining your concerns, explaining, hey, I'm not performing as well as I would like. It has nothing to do with you. That can also really alleviate some of the stress the other person may experience during intimacy. So really being open about it. I know it's a difficult thing to address because it can be sort of a difficult topic, especially talking about with someone that you're intimate with, but it does give you the chance to get closer with that person. So my advice would be open up, talk to your partner, and consider checking your testosterone levels to see if that could be a cause. If not, consider other avenues, but definitely consider also talking to your primary doctor. They've heard these questions before. They're not going to judge you. They want to make sure that you're feeling your best and having your best life. So talk to them as well. You'll be surprised at how open they are to how you're feeling.
Add us on Instagram at Primary Care Pod. Catch up on past episodes and don't miss out on new ones. Subscribe to the podcast on YouTube, iTunes, and Spotify at Primary Care Pod.